Welcome to our fifth and final module of the Champions Education series. Throughout our last four modules of this series, we covered the role of an IPAC champion, hand hygiene, risk assessments, and PPE with auditing. Now, we are going to finish off with environmental cleaning and disinfection. By the end of this presentation, you will be able to identify the difference between cleaning and disinfection practices, identify the different stages of environmental cleaning, be aware of the various cleaning products and methods and the pros and cons of each, and apply this knowledge and these practices within your setting. Two key documents you should know and have handy are the following. The first is the Key Elements of Environmental Cleaning fact sheet, and the next is the PIDAC's Best Practices for Environmental Cleaning for Prevention and Control of Infections in All Healthcare Settings. There are QR codes for both of them, so feel free to pause the video if you would like to access these. Please note that the PIDAC's document's latest version is April 2018. It's important to check these documents routinely to ensure you have the latest edition or version. Just to refresh our memories, and before we get into the details, let's start with the difference between cleaning and disinfecting. Cleaning is a removal of foreign material from the surface of an object. This includes any dirt, debris, or contaminants. Cleaning is the physical reduction of any contamination by using soap and water to break down grease and remove organic material from the surface. Mechanical action is the elbow grease that is required to help scrub or pull away the dirt or contamination after the detergent and water have helped to loosen or dissolve it. The act of cleaning itself will not kill microbial matter. And the last main fact to remember is cleaning is always the first step, as it is required prior to any disinfection step. Let's look at the different types of cleaners. The three types we are going to discuss are soap and water, detergents, and enzymatic. Soap is a fatty acid of a salt and is used as a cleaner or a lubricant. Soap cleans by acting as a surfactant and emulsifier. It can surround oil, making it easier to rinse away with water. Soap and water create suds in order to lift the dirt and wash it away, which tends to be a messier cleanup. Detergents are a synthetic cleansing agent that can emulsify oil and suspend soil. A detergent contains surfactants that do not precipitate in hard water and may also contain protease enzymes and whitening agents. Detergents have less sudsing due to the synthetic cleansing agent, so they require less time and water for cleanup. Enzymatic cleansers are a pre-cleaning agent that contain protease enzymes that break down proteins such as blood, body fluids, secretions, and excretions from surfaces and equipment. Most enzymatic cleansers also contain a detergent. Enzymatic cleansers are more likely to be used on contaminated items, such as reprocessing equipment, but can also be used in cleaning agents in facilities where there is higher tendency for blood and bodily fluid contamination. What is disinfecting? When done properly, cleaning as the first step is going to remove the majority of harmful microbes. Any small amount of microbes left behind can then be killed or deactivated through disinfecting. The disinfecting process is used to kill or deactivate most disease-causing microorganisms on objects and surfaces, but it's important to note that disinfection cannot be achieved without proper cleaning first. Disinfection is not always required, typically only when even the smallest amount of those harmful microbes can threaten human or public health. Low-touch surfaces, such as surfaces we don't touch often, are not typically disinfected unless there is a contamination of bodily fluids, such as floors or walls. However, high touch surfaces that can easily be contaminated with harmful microbes, we want to ensure are disinfected frequently as they pose a risk of transmission. Most disinfectants are chemical, which ensures quick effectiveness for surface cleaning. However, there would be other options or tools available for medical or personal care. Chemical disinfectants, which will be discussed more further on, can be deemed low, medium, or high, or sometimes regarded as hospital or healthcare disinfectants. This reflects on the spectrum or the amount of microbes they are able to kill or deactivate. Looking at the image we have on the right, we can see the spectrum showing which organisms are more resistant to disinfectant and less resistant. We can see COVID-19 and influenza A are quite susceptible and most disinfectants will work against them. Bacterial spores, however, are the hardest to kill as they create their own full body shield around them. Those who are on precautions for these types of diseases, such as C. diff, have their own protocols for cleaning and disinfecting and the use of a sporicidal disinfectant, typically an extra strong super duty chemical or gel.
Now, let's go a little deeper into what cleaning and disinfectant products are, their properties, and disinfectants versus one-step combination cleaner and disinfectants. As we know, there are different methods for environmental cleaning and disinfection. A variety of products can be used. The process and products used for cleaning and disinfection must be compatible with whichever surfaces and/or equipment they are used on. To start, there is the two-step process, which is to clean with one agent, such as soap and water, and then disinfect with another, meaning you are going over the surface twice. On the other hand, the one-step process is using one product that is both a cleaner and disinfectant, so you only need to go over the surface once. You want to make sure that you are always reading the label of the product you are using, as it will specify whether it is a one-step solution, and it will say one-step surface cleaner and disinfectant if it is the case. Also keep in mind that any disinfectant wipes, even if they are a one-step cleaner disinfectant, should not be used on heavily soiled surfaces, and any heavily soiled particles should always be removed or cleaned beforehand. Let's move on to properties of disinfectants. Environmental disinfectants in healthcare are most commonly a chemical agent used to destroy or inactivate harmful microbes on surfaces. Disinfectants have very specific properties that anyone using them must be aware of. We are going to review those 6 properties here. Number 1, a disinfectant must have a DIN or a drug identification number provided by Health Canada to be designated as an approved product. Health Canada also has a website to check if the particular product is effective against COVID-19. The one exemption to this rule is bleach. Number 2, an expiration date and shelf life. It's important not to use products past this date, as the concentration may have depleted to a level that is no longer effective. It's also important to always rotate your products on the shelf. Number 3, proper storage. Certain chemicals can't be exposed to heat or light as it decreases the concentration. Most need to be stored in a cool, dry, dark place, for example, a cabinet. Number 4, concentration. Products can be ready to use or come concentrated, which means that the user is required to dilute them to the correct concentration for safe and effective use. Always check the bottle and packaging and ensure you know what your product is and how it is to be used properly. Many companies will have the same product but offer it in the two forms, ready to use and concentrated. always check first. Number 5, manufacturer's instructions and safety data sheets, or SDS. Many of these chemicals you're exposing yourself to can be harmful if not handled properly, so it is important to know and understand what you're using. This is typically the fine print or the additional paperwork that comes with the product. You may have a full environmental or housekeeping team that provides you the condensed information you need, but there may be an occasion where you are the only one or two within the facility. So ensure you know all the information that is required. Being aware of the product you're using typically ensures you can determine what the product can be used on, such as what surfaces, finishes, furnishings, or other items. And number 6, contact time. The contact time of a product tells you how long that product needs to remain on the surface that it is disinfecting in order for it to be effective, or otherwise, how long the surface needs to be saturated for. Healthcare disinfectants typically have a contact time of 1 to 3 minutes to ensure fast and effective environmental cleaning. Household wipes, which are purchased usually from general stores, have a greater contact time of around 4 to 10 minutes. You must always read the label to ensure the contact time required for the type of environment you are using it on. For those with longer contact times, you may require more than one application of the product with the wipe if it dries on the surface too quickly. Let's do a quick activity. Using the information that we've just discussed regarding the properties of a disinfectant, take a few moments and see if you can locate all 6 on the images of the disinfectant wipes shown. Pause the module so you can take as much time as you need. This is a good opportunity to recap all the properties. As a hint, some of the properties are already highlighted. Once you have finished, you can resume the module and we will move on to the next slide. Here are the correct answers for some of the places that these properties can be found. Now let's discuss using bleach as a disinfectant. Recall that there is a difference between cleaners and disinfectants. Too often we hear the term cleaning with bleach. This is not correct. When using bleach, you must clean the desired area first with soap and water, then you can apply bleach as a disinfectant. Surfaces must be clean in order for the bleach to work effectively. Never mix bleach with other chemicals, such as other cleaning agents or disinfectants, to speed up the process of cleaning and disinfecting. When mixed with certain other chemicals or cleaners, it can produce toxic gases which can damage your lungs or be deadly. When mixing bleach with water, add the bleach to the water. Determine the amount of water first, and then add a small amount of bleach to it. Keep in mind, with bleach, a little bit goes a long, long way. Diluted bleach solutions are not stable, and because their concentration of their active agent is so low, it doesn't take much to change the solution, and diluted bleach actually loses its potency within 24 hours. Therefore, it is always best practice to only make what you need and discard after your task or round of cleaning. Full-strength household bleach is typically 5.25%. However, there are other available strengths and sometimes scents. Always check your products. Bleach is corrosive, which means it can irritate or burn your skin and eyes, and can corrode or eat metals. It is also commonly used to bleach or remove coloring or stains from clothing. No matter where it's being used, always use caution and care when working with this product. Both light and heat will decrease the concentration of your bleach solution, so bleach should always be stored in closed, labeled containers, away from both. Bleach is best kept in a cool, dry place for both full strength and diluted solutions. Whenever it is being mixed, it is typically done with cool water, not hot water, because of this reason as well. For routine surface disinfection, mix bleach solutions to 100 ppm, or approximately 0.01% of strength, and utilize the PHO or Public Health Ontario chlorine dilution calculator. This can be found on PHO's website, and we will take a look at it next as well. Let's take a closer look at a dilution example. When working with bleach, there are available dilution pages out there to help you determine what you need. Thunder Bay District Health Unit has a calculator, Public Health Ontario, as well as many other websites. As stated previously, typical disinfecting solution used is 100 ppm. So that is the example that has been placed in this calculator. Using a 5.25% bleach product and wanting to make 1 liter bottle at 100 ppm, the result tells us to add 2 milliliters of bleach to the 1 liter of water, which ends up being a little less than a half a teaspoon per 1 liter for the desired concentration of 100 ppm.
Over the next few slides, we're going to review the variety of ways a disinfectant can be used or applied. The first method is a preset concentrate. A chemical supplier will set up the device which automatically dispenses the correct amount of product to water ratio for you, so no measuring is required. The chemical supplier will set up this device, adjust it to the required concentration, and should also service this device. Sometimes the system has more than one solution, and it can include cleaners, floor degreasers, and other disinfectants. So it is important to know what you're using and that you're utilizing the correct one. These systems do need to be serviced to ensure they are still mixing that correct ratio, and facilities must be checking their disinfectant concentration in between services to ensure it is being maintained. Test strips for some disinfectants are available in order to do these concentration checks. The second method is the concentrate bottle. This is the disinfectant in the concentrated form, and this will have to be measured and diluted with water manually by the user. It is typically used to fill buckets or pour bottles. It is ideal to have a dedicated measuring container that is labeled or that has or you use a container that has a mark on it to ensure that the correct amount is measured each time. So kind of like a fill line. The third method is a spray bottle to apply the ready-to-use disinfectant. Spray bottles are not recommended in healthcare settings due to the occasional health concerns and the potential of the spray to disperse particles further than intended. If bottles are used, it is recommended to spray the cloth and not the surface. These are ready to use, so no dilution or mixing is required. The fourth method is pre-moistened wipes. These wipes can be sold as disinfectant wipes or a one-step cleaner and disinfectant. Reading the label will determine which one it is. These are not recommended for grossly soiled surfaces. The fifth method discussed is the pour top bottle. It is a ready-to-use disinfectant product, again, no dilution required, and it'd be applied to a cloth before being utilized on the surfaces. You pour from the top of the bottle onto the cloth, hence the pour top. So we are going to dive a little deeper into the most common methods of disinfecting, starting with the disinfectant spray bottles. As with other forms of disinfectants, sprays can also be in either one step or two step. A benefit or advantage to using a spray is no air will enter into the bottles, which maintains the efficiency of the product, meaning the disinfectant is unlikely to become contaminated and the concentration can be maintained for longer periods of time, so a longer shelf life. A disadvantage is that the aerosol or trigger sprays may irritate sensitivities, allergies, or could result in eye injuries. Due to this, utilizing these are not best practice within a healthcare setting, and this recommendation should be considered within our congregate living settings as well. Next one is disinfectant wipes. These have become the most popular choice since our COVID pandemic within our congregate living settings. So we didn't see them as much prior to the pandemic, and now you can kind of find them everywhere, every office, every congregate living setting, even everyone's households. So disinfectant wipes can be purchased as either a disinfectant only or as that combined cleaner disinfectant, that one step. So you have to remember you must read the label to determine what it is. You don't want to be using just a disinfectant wipe as a cleaner and disinfectant because you're missing a whole step there. So, most of our hospital or healthcare grade wipes, so those you might purchase through a supplier, those are typically going to be the one step. So, they'll clean and disinfect. But again, it will say that right on the label. The household ones that you might get at your grocery store or your hardware stores, those are typically just a disinfectant wipe. You can also purchase just cleaning wipes, but not necessarily the combination of the two at these locations. We have had many facilities make this mistake, so ensure that you know your products. Make sure that you are reading them. So, wipes may become dry due to fast drying agents within the product. This property helps to reduce that contact time for disinfecting when you're using them correctly, but also can cause the wipes to dry out quickly if that lid is left open and exposed to air. So, you have to ensure those lids are snapped shut properly when you're not using them. One trick is you can store the container upside down, and that ensures that that lid's closed all the way and nothing gets dried out. If the wipes do become dry, you need to discard them. Wipes need to be wet to be effective. A dry wipe's not going to disinfect because you're not going to have that contact time. And if you add water to them, what you're doing is you're diluting that concentration. So they're no longer going to be effective. They're not going to have that concentration of disinfectant to actually kill anything there. It's just going to be too watered down. So again, wipes are also not recommended for heavily soiled. So if you see a big spill or anything, you're not going to use a wipe to clean up that spill and leave it disinfected behind. They're just going to become oversaturated, and that's not what they're meant to do. So you would still have to clean that area separately, get the gross soilage off, and then you can use the one step or two step disinfectant after. Now we're going to move on to the bucket and pour top methods. So we just kind of combine these two into one slide. Again, this can be a two-step or one-step process depending on the solution of choice. With any method you pick, there are advantages and disadvantages. So pour tops may be difficult to effectively soak the cloth because you're trying to pour it onto a cloth in your hand. Therefore, that can reduce the amount of surface area or some product waste. Buckets can pose a risk of double dipping. So, double dipping or dipping a used cloth back into a bucket impacts the concentration of that disinfectant. So, you're going to be diluting it or making it dirty. So, then the concentration in that bucket is going to be attacking what's already on the cloth, and you're going to have less to bring back out. So, we don't double dip. So I always say if you don't double dip your chips, you don't double dip your cloths. So same idea. So you're going to take that cloth out, you're going to use it on all the surfaces, and then you're going to put it into a dirty bucket. That cloth, once you remove it, never goes back in. You also want to ensure you never store the cloth in the bucket between uses because, again, that's double dipping. And you want to ensure that you follow the proper technique and use the cloth fold method, which we'll look at a little bit after. So regardless if you use the bucket or the pour tops, it would be ideal with that cloth method. So you're going to fold it twice to get 8 wiping surfaces. When you fold the cloth once down the middle and then fold it again, that gives you 8 equal surfaces. And then that way you can keep flipping the surfaces over and you never have to double dip back in because it's all going to be saturated and you have a new surface when once gets used up. So you can see a quick video if you want to pause the presentation now. You can go ahead and scan the QR code, and this will allow you to watch a little video of how to use that cloth fold method that we just described to you. And it is a YouTube video. Next, we're going to talk a little bit about spray disinfection systems. So there are two different types. One is an electrostatic sprayer and the other is a fogger or mister. So an electrostatic sprayer is a device that works by applying a small electrical charge to tiny disinfectant droplets called aerosols when passing through that nozzle. Um, these charged droplets are more attracted and stick better to surfaces. So that electrostatic force is actually greater than natural gravity. So rather than just allowing the the droplets to go out by gravity and naturally gravitate to surfaces, this charges them so then they go quicker and they stick better. So, a fogger or a mister is a device that uses a fan and a liquid to create a fog. So, like aerosol, small droplets, or a mist. So, I always think of those fans on spray bottles of water that you can mist yourself with on a hot day. Exact same idea. It's just taking those bigger droplets and the fan breaks them down to smaller ones. So while static spraying differs from fogging, the CDC recommends against the fogging disinfection based on concerns about adverse effects on healthcare workers. And we'll dive into these just a little bit more too. So, although not recommended, it has become a larger used practice, especially during the pandemic, and some facilities have opted to continue with it. So, with many new technologies out there, they are interesting and innovative and new, but we do want to provide a little bit more guidance if you are going to be using them within your facilities. So, there is a Public Health Ontario fact sheet. You can scan the QR code there if you want a link to that as well. So, as always, it is important to read the manufacturer's instructions for safe use on both types of systems. Um, so, for an example, you may need to have proper PPE, or there might have to be exclusions in the room when things are being used. But let's dive into it now. So, when you're using an electrostatic sprayer system, you must use an approved disinfectant that is designed for the machine. So, disinfectant products, as we mentioned earlier in this module, are approved by Health Canada and they do have a DIN. And your model may say use this specific disinfectant. So, you're not going to just pick any other disinfectant to use with that model. It's designed for it for a reason. It's something that's been tested with. They know it works with it. They know the health effects of it. So, only use what you're supposed to with the system. All items and surfaces to be disinfected are to be cleaned first with a soap and detergent before this application. The electrostatic spraying system is just applying a disinfectant. It's not applying a cleaning and disinfectant in one, and you're not getting any of that mechanical action, that elbow grease for that cleaning. So, again, this is just a method for applying disinfection. It doesn't replace that cleaning step. Also, these systems should only be used by trained professionals. So, if you have a new employee in your facility, you're not going to hand this over to them and say, hey, spray all the surfaces. No. First, they're going to need to be properly trained how to use it, what disinfectants are to be used with it, how to handle those disinfectants safely. They have to be aware of all the safety measures in order to protect themselves and then others within the facility. These should also only be used in rooms when they are not occupied to reduce the risk of inhalation of the product. So, again, you're not going to be walking around with one of these when there's other people in the room, especially if they're eating or drinking or sitting down and do activity. You're not going to, if they're sitting on the couch, you're not going to come up and start spraying that couch where they are. You want to make sure that no one's in that room and follow the manufacturer's directions. They may say, ensure no one's in the room for half hour after or an hour after. You have to read all those safety guidelines. So these should also be used with extreme caution if using around food prep or areas where children play. So any inspected kitchen has limits to what chemicals can be used on its surfaces, and this is to ensure that no chemicals are ingested within our food or drink. So make sure you follow that, and if you're unsure, you can always connect with your public health inspector at the health unit. Also, children tend to put their hands and other objects into their mouths very often. So there is guidance to what is allowed in daycare and areas where children's have exposures to chemicals. So just be mindful of that. Where are you using it? Why you're using it? And how are the objects being used that you're using it on? Okay, great. Now that we finish this section, we're going to go next to a concept check. So we're going to see what we've learned so far. So, which of the following statements regarding cleaning practices is not true? A. Cleaning physically reduces contamination by breaking down grease and removing organic material. B. Cleaning is a mechanical action with water and detergent. C. Killing kills the microbes on the surfaces. And D. Is the step that always precedes disinfection. If you need a minute, you can go ahead and pause. If not, we'll go to the answer now. So the answer is C. Cleaning does not kill the microbes. Remember, cleaning removes the microbes. Disinfecting kills the microbes.
So for a quick recap, we know we always need to clean a surface before we disinfect it, and we've learned the differences between the two methods. We know that there are different routes to achieve cleaning and disinfecting, and different methods to apply these products, such as buckets, pre-moistened wipes, etc. Next, let's take a look at some general practices. What does it mean to work from clean to dirty? Working from a clean to dirty flow means that the least soiled areas are cleaned first, followed by the more grossly soiled areas last. For example, think of a client's room with an attached washroom. You would want to start with the bedrooms and living space of the room first and end with the bathroom as it will be the most soiled. What we mean by the most soiled is it has the greatest potential to carry harmful microbes due to the bodily fluids that occur within that area. A best practice when following the clean to dirty method is to start with low touch areas and move to high touch areas due to the amount of bacteria present. And what do we mean by low touch and high touch surfaces? And why does this apply to environmental cleaning? Being aware of low and high touch surfaces helps to determine which surfaces must be disinfected while performing environmental cleaning. The name is pretty straightforward to the description, where high-touch surfaces are those surfaces that we touch frequently with our hands throughout the day. For example, doorknobs, door handles, phones, shared devices like computer stations and tablets, light switches, elevator buttons, and handrails. Low-touch surfaces are those that have minimal contact with hands throughout the day. Some examples include floors, walls, and windowsills. High and low touch surfaces are not going to be the same for each facility. They will be unique to your setting and could even be unique to different areas or units within your setting. So again, to recap, we always start with low touch areas and move to high touch areas. We always make sure to remove any gross debris or dirt before cleaning and disinfection. We know that there should be no double dipping of cloths in cleaning solution as this can result in contaminated surfaces. We also don't want to shake mops as that can spray the contaminants around the area. No topping up of containers. This means containers should be emptied, cleansed, and disinfected and dried prior to being refilled, and that's only if the container is manufactured for this purpose. Most important, always protect yourself while performing environmental cleaning. Be sure to use your personal risk assessment to determine appropriate PPE required and utilize the moments of hand hygiene. Let's look at the term hotel clean and what it means. Hotel clean is the measure of cleanliness based on visual appearance, which includes dust and dirt removal, waste disposal, and cleaning of windows and surfaces. Hotel clean is the basic level of cleaning that takes place in all areas of your setting. This includes public areas such as lobbies, offices, corridors, hallways, elevators, stairwells, or service areas. Essentially, hotel cleaning applies to all areas not involved with direct treatment or client care, which we will touch on next. Now that we've learned what hotel clean is, let's discuss healthcare clean. Healthcare clean aims to reduce or eliminate microbial contamination within the environment. It's the heightened measure of cleanliness routinely maintained in client areas where healthcare is provided. On the previous slide, we discussed hotel clean, which is the routine cleaning standard and covers the basics, but healthcare clean includes hotel clean with the addition of disinfection, increased frequency of cleaning, and other infection control measures. In many of our smaller congregate settings, both hotel and healthcare clean still apply. However, they would just need to be adapted to the specific setting and environment, and as always, focusing on those high-touch surfaces versus low-touch surfaces. Let's take a look at the components of healthcare clean a little closer. The healthcare clean component of the setting should be the priority for environmental cleaning. In other words, where care is being provided to a client, it is a top priority for cleaning and disinfecting over any other public spaces. Client rooms, medical rooms, and washrooms take priority over an entranceway or a living room. Although common spaces may be what people see more frequently, the risk of transmission is much greater in health or personal care areas. As you see on the slide, healthcare clean is going to include the basics of hotel clean, but also adds a disinfecting step to high-touch surfaces, non-critical medical equipment, and also includes an auditing or educational component. Let's look at these additions a little closer. High-touch surfaces in client care areas are cleaned and disinfected with a hospital disinfectant. High-touch surface hospital disinfectants commonly used are stronger than hotel or household disinfectants. Commonly used chemicals include ethyl alcohol, isopropyl alcohol, accelerated hydrogen peroxide, iodophores, which are iodine-containing components, phenolic cleaning solutions, which are phenol cleaning solutions, quaternary ammonium compounds, and bleach. Non-critical medical equipment is cleaned and disinfected between clients. This refers to equipment or devices that touch only intact skin, so not touching mucous membranes, or it does not directly touch the client, patient, or resident. An example of these would be blood pressure cuffs or stethoscopes. Cleaning practices are periodically monitored and audited with feedback and education. This is a large piece we are going to discuss over the next few slides. Time for another concept check. So true or false? Hospital clean is hotel clean with the addition of disinfection, increased frequency of cleaning, auditing, and other infection control measures in client, patient, and resident care areas. The answer is true. Referencing our previous slide that defined hospital clean, also known as healthcare clean, incorporates the traditional hotel clean, dust, dirt removal, waste disposal, and cleaning of windows and surfaces, plus additional measures that are stated here on the slide.
Cleaning practices are periodically monitored. That indicates that there has to be some accountability to ensure completion and consistency. This could be a regular schedule posted for cleaning all surfaces and may include items that have to be cleaned and disinfected on the list. It could also indicate the staff member who completed the cleaning with the use of their initials. These lists may be completed through an honor system, where staff ensure one another are completing it, or a supervisory role that oversees their completion. If capacity should allow, auditing cleaning practices should be achieved. That is more than just ensuring the lists are completed. You want to determine the practices are being done correctly, such as the right products being used, the right application and method, and no double dipping. This is achieved through observing and utilizing observation tools or auditing tools. There are solutions you can apply to surfaces that then illuminate with black light, so it will indicate if surfaces were missed or not enough mechanical action is occurring on the surface. As always, there needs to be an ongoing conversation about the cleaning practices. Continue to educate after the audits, so it's not disciplinary, it's a learning moment. Education and awareness should also occur without audits. From the best practices document, here are some resources found in the appendices. On the left side, we have a checklist for routine daily cleaning of a client room. It's a good base that you can add or subtract from to meet your facility goals. If you don't already have your own, you can just use it as a reference and determine if you need to adjust your list. On the right side, Appendix 3 is a general flow for all healthcare settings. This is beneficial if your facility doesn't already have something in place. These are some snapshots of some of the observation and audit tools that IPAC Canada has available if you are a member. It is broken down into sections, so you may be only auditing or observing areas of this chart rather than the whole document each time. It can be found on their IPAC website under Resources and Auditing Tools if you are a member. Routine practices and additional precautions. Within certain settings, environmental service workers may be exposed to blood or body fluids and microorganisms that contaminate the congregate care environment. The guiding principle of routine practices is that all clients, patients, or residents may carry harmful microorganisms regardless of their isolation status or diagnosis. Routine practices are essential practices that must be followed by all staff working in clinical areas and are intended to prevent the transmission of organisms and to protect both staff and residents. Routine practices include hand hygiene, use of PPE when indicated, safe management of sharps, cleaning and disinfection of equipment that moves from client to client, and overall environmental cleaning. When a client is on additional precautions, this can be contact precautions, droplet contact, or airborne, it is important to follow the requirements for PPE and handling of equipment based on the requirements indicated on signage and within your facility's policies. These cleaning practices can differ depending on the precautions in place, which we will review next. Additional practices are enhanced cleaning and disinfecting aimed at specific situations. If you recall the spectrum of microbial resistance, C. diff is an example of a sporicidal bacteria that is more difficult to disinfect, so it requires its own environmental cleaning practice or guidance. Any patients or clients who are on additional precautions, there will be more cleaning or disinfecting laundry and disposal for them, and therefore more time has to be allotted, which could also mean an increase in staffing. Personal protective equipment for healthcare providers and other staff can be used alone or in combination to protect mucous membranes, airways, and skin and clothing from contact with infectious agents and from chemical agents. It is the responsibility of the healthcare setting to ensure that PPE is sufficient and accessible for all staff for routine practices and additional precautions, as well as for personal protection from chemicals used in cleaning. It is also their responsibility to ensure staff have completed WMIS training regarding appropriate handling of biohazardous material within the workplace. Next, we're going to look at the specifics of glove use within environmental services. Unnecessary or prolonged wearing of gloves is not recommended in any role. Prolonged exposure to gloves increases the risk of irritant contact dermatitis from sweat and moisture within the glove and increases the risk of tears. Gloves must be removed immediately after the activity for which they were used and discarded. Continuing to wear the same pair of gloves while moving from one patient environment to another or between the patient and the healthcare environment facilitates the spread of microorganisms. It's also important to note that disposable gloves should never be washed. Environmental service workers must not walk from patient environment to patient environment and between patient and healthcare environment wearing the same pair of gloves. And most important, you must remember that gloves are never a substitute for proper hand hygiene. In addition, gloves are not required for certain tasks, such as sweeping or mopping floors, pushing cleaning carts within the hallways, or handling clean linen. When additional precautions are in place, some tips and points to remember when performing environmental or cleaning services within your settings include: before entering the room and additional precautions, and supplies should be gathered before putting on personal protective equipment. We never want to bring cleaning carts into the room. All cleaning tools and equipment, such as cloths, mops, or pads, used to clean a room or bed space on contact precautions or droplet precautions, must be cleaned and disinfected after use and before being used in another room or bed space to avoid cross-contamination. When cleaning rooms on additional precautions, it is also important to have protocols and to clean the portable isolation carts or built-in holders used to store the personal protective equipment.
Let's take a look now at different types of waste. Types of waste that can be generated in a healthcare or congregate setting include biomedical waste, sharps, and general waste. Biomedical waste, including sharps, requires special handling and disposal. General waste, for example, PPE from isolation rooms and waste from kitchens, washrooms, and public areas, does not generally require special handling, although any heavily soiled items should be disposed of in a contained manner. No matter what category it falls under, it's extremely important that environmental services staff are aware of and trained on the various types of waste and their organization policies for safe handling and disposal. When it comes to laundry services, generally there are no special precautions required. That being said, any linen that is soiled with blood, bodily fluids, secretions, or excretions should be handled using routine precautions and treated as if they could be contaminated, regardless of whether the client is on isolation or not. Some additional points to consider when it comes to laundry services in congregate or other care settings. Clients' mattresses and living spaces should be cleaned and disinfected between clients. Gloves are to be worn when handling dirty laundry, and all laundry should be handled gently and without shaking. Regular laundry soap and hot water are generally used. Clients have their own clean bedding and towels, which are not to be shared. And bedding and towels are washed on a regular schedule. Next, let's explore two of the most common questions that we get. The first one is, how do I dispose of a product after use? Most products are at a concentration that can be flushed and/or put down a sink. When looking at disposal, it's important to follow manufacturer's instructions or MSDS sheets, as they should contain this information, most often in the product or spill cleanup section. You always want to ensure you are disposing of the product in a manner to protect yourself. PPE may be needed to protect yourself from splashes or sprays. Last, be cautious if on a septic field. Ensure concentrated forms aren't entering the system or large quantities of chemicals. Check with the supplier to make sure it is septic safe. The second most common question we get is, what do I do with an expired product? So for expired products, some suppliers may accept the product back. For example, if it was shipped or provided to you and it ends up expiring within the month. In addition to that, some suppliers may accept it back to ensure that it is disposed of properly. It's important to check with the local landfill as well, as some do accept household chemicals for appropriate disposal. If none of those options work, then you can refer to manufacturer's direction for the correct disposal of the expired product. For example, whether it can go down the sink or drain after dilution. Now we'll look at discharge or transfer cleaning. Although it was previously referred to as terminal cleaning, throughout the best practice document it is referred to as discharge and transfer cleaning, and for the purpose of this education module, we will refer to it as DT cleaning to simplify it and because IPAC loves acronyms. DT cleaning is the thorough cleaning of a client room or bed space following discharge, death, or transfer in order to remove contaminating microorganisms that might be acquired by subsequent occupants and/or staff. In some instances, discharge cleaning might be used when some types of additional precautions have been discontinued. Cleaning and disinfection upon discharge includes several steps not required during routine daily cleaning, and it requires the close cooperation of clinical staff and cleaners. Sometimes this may be one person acting as both the clinical staff and cleaner, typically within smaller facilities. A good way to think of DT cleaning is comparing it to buying a new home. The house must be first emptied of the previous owner's belongings, and then you will clean it prior to putting your own belongings in. If they've left any cleaning or personal items, you are going to remove them and obtain your own, such as a toilet brush. We think of our clients' rooms as their homes, and thus they should be treated the same. Turnover time, otherwise known as the time it takes before a new client can move in, is determined by DT cleaning, as more steps are applied and therefore DT cleaning takes additional time. This means there may be a need for more allocated time as well as staff resources. In general, clinical staff are responsible for removing or discarding medical supplies, removing items or equipment potentially contaminated with blood or body fluids, and disposing of any personal items left behind, as these items have the potential to transfer disease to the next client or other staff. If the client is under additional precautions, having the minimum required supplies within the room prior to discharge can help ensure a faster turnover. Shared client items, such as toys, should be sent home or appropriately washed, disinfected, and rinsed for the next user. This is applicable to many of our shelters or if the client is discharged from a youth facility. Toys could also include gaming systems, remotes, and other electronic devices, plush toys, etc. Once these tasks are all completed and all of the required items have been removed, cleaners can then come in to perform a discharge transfer clean of the room environment, following the steps outlined in Appendix 6 of PHO's best practice document. During the cleaning process, environmental and cleaning staff are responsible for completing a full and thorough clean of the room. All cleaning tools and equipment, for example cloths, mop heads or pads, used to clean a room or bed space on contact precautions or droplet precautions must be cleaned and disinfected after use before being used in another room or bed space in order to avoid any cross-contamination. At facilities that do not routinely change privacy curtains for all discharges and transfers, privacy curtains must be changed when cleaning rooms of all patients that were on additional precautions. There must be a process to ensure that there has been adequate cleaning and disinfection of rooms or bed space and shared equipment following client discharge or transfer. This may be accomplished through the use of a task checklist to ensure that all areas and surfaces are cleaned and disinfected and that post-cleaning inspection of the room or bed space has taken place. For this, you can see Appendix 4, Appendix 6, and Appendix 22 in the best practice document for sample cleaning protocols and checklists. Okay, we have now made it to the end of our education series. Let's go over a brief recap of some of the highlights from this module on environmental cleaning. Remember the basics of environmental cleaning. Both cleaning and disinfection steps are required for effective environmental cleaning, and there are various methods that can be used. Remember, bleach is for disinfecting only and requires proper dilution. Know your products. Is the product you're using just a cleaner and separate disinfectant, or is it a two-in-one product? Be sure to know what the intended use of your chosen product is prior to using it and what surfaces is it compatible with. Also, what are the advantages and disadvantages of this selected product? Are there any risks to the user? Is PPE required? Are staff educated on its proper use? It's important to ensure you are addressing the products and use on a routine basis. Always flow from clean to dirty, and remember the difference between low-touch and high-touch areas. Rooms on additional precautions or with particular microorganisms may have specific cleaning and disinfection requirements and protocols, such as C. difficile or MRSA and VRE. If performing terminal cleaning, make sure you are following the required steps. These are outlined in the checklist we highlighted from the Best Practice Guideline for environmental cleaning. And lastly, if using an electrostatic spray system or fogger in your facility, you must be trained and have a thorough understanding of the system and the disinfectant that are in use. Again, we caution the use of these devices due to the adverse effects on healthcare providers and users. Congratulations! You have completed Module 5 of the IPAC Champions Education Series, which means you have now completed the full series. We invite you to contact us with any questions or concerns regarding the modules, or if you would like any further training on any of these or other IPAC topics. You can connect with our team by sending us an email at ipachub@tbdhu.com at any time. We look forward to hearing from you. Thank you.